Good morning, this is Jay Morein with the Colorado Department of Human Services. Today is May 9th, or is it May 10th?
Today's the 10th.
Today is May 10th. Thank you, Jamar. We're re-recording a narrative in an abbreviated fashion for a webinar that was presented to county department participants on May 7th, where we walked through some of the decisions yet to be made and ones already discussed with the Works Allocation Committee regarding the fiscal year 13-14 allocation of child welfare services. The narrative that I'm recording today will be an abbreviated version of what was presented on May 7th. Not moving on the screen. Thank you. So just as a quick background, Colorado has operated its allocation process for child welfare over the past decade using an optimization allocation model that counties are familiar with. The counties and Child Welfare Allocation Committee members had come together back in August of 2012 to establish guiding principles to help them and us at the state in thinking of how to develop a new model. And there were a number of principles that did inform us in terms of the model that we'll be sharing today. First, the principle of having a model that was easy to understand and convey. One of the ongoing criticisms of the optimization model is that it was neither easy to understand and certainly wasn't easy to explain to others. Second, there was a desire to have an equitable starting point. Third, reinforcing and supporting the strategic direction that the counties in the state have taken and are taking for child welfare, moving the system forward. Fourth, incentives, establishing incentives within the model that would both enhance practice and help in achieving outcomes. And disincentives, something to address counties with declining or ongoing poor performance. One of the principles discussed was around how we would allocate to the 10 large counties and the balance of state counties and whether or not a different methodology should be developed for those two groupings. The principle was that if it was in the best interest, different methodologies could be developed, although not necessarily an expectation if one methodology would apply effectively to both groupings of counties. Seventh, limiting the annual adjustments to the base to prevent large year-to-year shifts, so some control over the volatility of the allocations, particularly concerned about allocations dropping significantly from year to year. And finally, a principle of freezing on the new base allocations over a 3-year period. So with those principles, the department, at the request of the counties, developed a proposed model that has been presented to the allocation committee for their consideration. And the model identified 61 different variables or cost drivers that could potentially or possibly be used in a new model. The department chose to use 7 of those 61 variables weighted as follows. 20% of the model would be built on child population, 5% on children in poverty. The greatest variable weight was assigned to program service costs at 40%, and that was based on the average of program service costs incurred over a 3-year period of fiscal years 2010 through 2012. 15% on foster care days paid, 5% on congregate care days paid, 10% on subsidized adoption and guardianship days paid, and 5% on new subsidized adoptions and subsidized guardianships. And for each of those last 4 variables, again, we were using a 3-year average from fiscal year 10 through 12. So from those weights, we'll explain how that worked or works within the proposed model. What do the weights mean? Well, the weights are assigned to indicate the portion of the available funding distributed based on each county's measure with regard to that variable. So by example, in the model that was illustrated and shared with the allocation committee in meetings in April, we populated the model with $323.7 million distributed to the counties based on the different variables. So if child population is assigned a weight of 20%, then $64.7 million, which is 20% of $323.7 million, will be distributed based on child population. To extend that example, if Adams County's child population is 10.52% of the statewide child population, then the model will distribute 10.52% of $64.7 million, or roughly $6.8 million, to Adams County for this one factor or variable. And so you can apply that same mechanics to each of the 7 variables. 40% of program services, which would be roughly $129 million, would be distributed to counties relative to each county's proportionate share of the overall amount of $129 million that was spent on the program service component. Why did we choose the weights that we applied to each of those variables? We'll look at that in this next slide. Child population and children in poverty are seen as stabilizing factors. You'll recall that we had assigned a weight of 20% to children, or child population in each county, and 5% to children in poverty. We gave children in poverty a higher weight proportionately based on the generally accepted position that poverty is an indicator of higher system penetration, which in turn would drive higher costs. So while we have what's relative a 4-to-1 ratio by having a 20% and 5% weight assigned to child population and children in poverty, what we know is that children in poverty only constitute 1 in 6 kids in the state of Colorado. So by bringing that ratio to 1 in 4 or 4-to-1 in this case would proportionately drive more of the allocation to those counties with higher poverty. Program services costs were given a greater weight than out-of-home placement. Looking at the subcategories of cost in program services and out-of-home placement costs, we found that about 62.6% of the costs for programs were incurred in program services and 37.4% were in out-of-home placement. In the proposed model, we've created a 2-to-1 ratio, so relatively have increased the weight assigned to program services costs just by a small amount. We've increased it from the historically incurred 62.6% to a weight of roughly 67% in the model. This is in support of counties' practice that the state is favoring to support more in-home services and reducing out-of-home placement costs. So the philosophy there is one that's further supported by the 4E waiver, and we'll talk about that here in just a couple of slides. Finally, foster care days paid are given a greater weight than congregate care, and subsidized adoption days paid is given a relatively greater weight than out-of-home care. Again, supporting the philosophy that the counties and state have been striving for in terms of both reducing the use of congregate care and supporting permanency. Other features in the model include having an incentive-driven allocation component. The model proposes carving out 2% of all available funds to be distributed equally to 3 different performance measures, those being absence of recurrence, permanency, timeliness of assessment closures. And then finally, establishing a 5% floor to avoid the volatility. So looking back at those principles that were adopted in August of 2012, we believe that the proposed model is both easy to understand and convey. That's certainly been our intent from the outset. We believe it reinforces and supports the strategic direction that the department is taking. It does build in both incentives and disincentives, the disincentives really being in how the department has proposed weighing the different variables to favor more greatly subsidized adoptions and foster care over congregate care and program services over out-of-home placement. It also does build in the 5% floor, which limits the annual adjustments to the base to prevent large year-to-year shifts. Equitable starting point, I have a question mark there whether we achieve that. I think that's as much in questioning whether anybody could really clearly define an equitable starting point. Thank you, Elise. The differences in methodologies for the groupings of counties, leave a question mark there. We haven't decided yet whether or not the model would allow for that. Right now, it's our belief that the model can be applied to all counties equally and that there doesn't need to be a different methodology. And the 3-year freeze on the new base allocations really isn't something that the model would propose. That may be something that the allocation committee may want to propose, although it would be a year-to-year decision on their parts. How much is available to child welfare services? I'll say that this is and continues to be evolving. What the model has been built around is having $326,738,000 allocated both in the current fiscal year and in the coming fiscal year. We do recognize that there has been a negative supplemental approved by the legislature that reduced the amount of the appropriation in the current year by $3 million. We also know that in next year we will have roughly $6.7 million made available for the 4E waiver interventions, bringing us to that same $326.7 million to distribute in this coming fiscal year through the model that we've presented. We know that a couple of the federal funding streams are subject to sequestration that help to support child welfare services, and those are noted at the bottom of the slide here. Title 20 Social Services Block Grant provides some funding to child welfare to the tune of about $23 million. We have another couple million, or no, I should say about $4 million in Title 4B or Child Welfare Block Grant. Each of those funding streams are subject to sequestration and may impact the final level of funding available for this coming fiscal year. We know, too, that the legislature in adopting Senate Bill 230, the long bill in this past legislative session, provides additional funding for child welfare, whether it's in the block grant or in other lines. Core services received an additional $6.1 million. Provider rate increase for core services provided another $900,000 roughly. Child welfare services provider rate increase provided just under $6.7 million. Have an appropriation set aside for a community-based prevention program of $900,000 and a separate line for prevention program Safe Care of $1.9 million. So all told, there were about $16.5 million in new funds that were appropriated through Senate Bill 230. Quick run through on the Title 4E waiver. This is a demonstration project covering 5 years. We have federal terms and conditions that we have executed with the Administration for Children and Families, establishing an implementation window that closes October 1st. It's our intent on implementing the interventions beginning July 1st. The demonstration project goals include increasing permanency, positive outcomes, and safety and well-being, and preventing child abuse and neglect and reentry. There were 5 waiver interventions to be delivered with fidelity, those 5 being family engagement, trauma-informed child assessment, and trauma-focused behavioral health treatment, permanency roundtables, and kinship supports. Counties have received information from the department related to how those programs will be administered and how counties can apply for some of the waiver intervention funds. 4E funding under the waiver agreement includes a capped allocation of federal funds averaging roughly $48.9 million over the next 5 years, or about $9 million more than the state had earned in the last fiscal year. Funding components included in the capped allocation are foster care maintenance, case planning and administration, and eligibility determination. Components outside of the capped allocation are subsidized adoption and subsidized guardianships, trails, state administration, and training. So each of those that are excluded components will continue to receive entitlement or federal matching funds for all eligible activities. This next slide shows how much the department negotiated by year, and it's on an increasing level. If we look at the column on the far right side, we see that the amount of funding available increases by about $1 million a year, starting at $46.9 million and topping out at $50.9 million in state fiscal year 2018. A few points to make here. The waiver requires that it implement a number of the waiver interventions during the 5-year term of the agreement. It doesn't require that we do so all at once, but by the end of the 5 years, we need to have implemented each of the 5 interventions. It does identify allowable costs for the use of the funds under the capped allocation being expanded beyond what was traditionally associated with 4E eligible kids to more broadly include costs associated with Title 4B, which includes out-of-home costs for non-4E eligible children and prevention costs. And finally, the department does not need to draw down the funds in accordance with the schedule that sits at the top of the slide. It can draw, for example, more of the funds in the first or second years and work on a declining balance following those couple of years. It's a decision the department hasn't yet made but is entertaining. This slide really just quickly looks at how 4E cap funds appear in the long bill and compares that to what our funding would be without the waiver. You can see that in the long bill we've appropriated $47.6 million. Without the waiver, our appropriation of 4E funds would have been about $8 million less than was actually appropriated. So we have a number of outstanding issues and next steps that will be taken at the May 17th Child Welfare Allocations Committee meeting. We'll be analyzing the impact of changing weights assigned to child population and children in poverty. The model is populated again with a ratio of 20% and 5% for those two populations. We were requested to run the model, changing those ratios to 15% and 10%. At the allocation committee meetings on April 11th and 12th, El Paso County brought forward a specific issue related to program service costs that they now have embedded within their out-of-home placement line. And so the department has been analyzing the impacts of El Paso County's practice, and we'll be bringing that analysis to the meeting on the 17th. There's an error in the worksheet that the department had prepared and presented related to the mitigation holdout, and so we'll be bringing the corrected model on the 17th. We'll be adjusting to the actual funding available for the current year and fiscal year 13 and 14 to the committee. That goes to an earlier slide where we identified the amounts of funds available and letting it be known that that was a work in progress. We are still working towards what the actual amount of funds available are for both the current year and this coming fiscal year. Some of that being related to actions taken by the Joint Budget Committee at the end of the figure setting for Senate Bill 230. We'll be bringing to the committee not only the proposed model, but for comparison purposes, the historic optimization allocation model and the results it would have using the same data that's been used in the proposed model. We'll also be bringing the core services allocation options, which had not been yet presented to the committee, and we will be conducting a webinar to provide more opportunities to explain the proposed core services model. This being kind of post-recording, that webinar actually was held on May 9th and has been posted as a YouTube for viewing for those who want to see that webinar as well. And finally, once again, the CWAC, or the Child Welfare Allocation Committee, will be reconvening on May 17th to hopefully make final decisions. All of the materials that will be shared with the Allocation Committee will be sent out to committee members and other parties who have been incorporated into a large mailing list by Jamar White at close of business today, May 10th. So if you're on that list, you may be watching for a fairly large mailing coming to you sometime this afternoon. And with that, understanding this to be an abridged and after the fact recording, I'll bring this to a close.
Thanks, Jay.
You bet. I was looking for you to close me out of here. Beautiful.